What's up, Internet? Wanted to jump on and talk about an experience in the clinic today. So the title of the video is My Patients Teach Me Most of What I Know, which is pretty much, for the most part, true now that I'm out of school. I mean, obviously I went to school for a long time, 4 years undergrad, 3 years of grad school, bunch of continuing ed since. But now, Safka and I were talking last week sometime, it's like, every session that we have is a learning experience. Every patient, every decision that we make, we've set ourselves up where we're one-on-one the entire time. We can kind of go back and analyze pretty closely, what went well, what didn't go well. So, this whole last year plus a few months, going and doing our own thing has been a huge learning experience, and mainly, due to the people that we work with on a day-to-day basis. And today the lesson that I learned is, never assume. This one particular individual that I'm working with, a professional athlete actually, I feel like the bias is with professional athletes that you have to do something, kind of crazy and extreme, because they're at the top of their game. It turns out this person is missing some very basic things. I've been one to trash and kind of, badmouth TheraBand exercises, but that's what we're doing. We're doing, basic kind of, unidirectional TheraBand ankle exercises, and he's getting better. So, I mean, you can never assume. And then there's also the other end of the spectrum where, I got another person I work with, they'd come to me after things weren't going well with another PT because they were getting pushed too hard. Basically what that comes down to is, listening to your patient, what they're telling you. Are they responding to the treatment that you're giving them? And like I said, not assuming just because, you have a certain thought about where a person should be. Well, test them and see if they are. It's that simple. If they're not, bridge that gap. You think, again, professional athlete coming in, you think they're going to be, high performance everything, but if they're having an issue, that's why they're there to see you. So, it could be a basic thing, so don't assume. I know I've had a few people, former classmates and other colleagues, reach out to me, not recently, but over the past few months, about some higher level clients that they might be treating, someone that's, not their typical caseload, and just asking for some advice. And the biggest thing you can do is examine, find what their deficits are. It doesn't have to be anything crazy, and attack them. This might be a short one. My battery's gonna die here. But yeah, that's the lesson I learned today. Humbled once again. Don't assume. Even if they're a pro, even if they're grandma, especially if they're grandma, don't assume that, you're just going to be doing stuff on the table, basic, quad sets and bridges and whatnot. Challenge that person. That's probably what they need most. But again, that's individualistic. It depends on the exam. Moral of the story is don't assume. Cool. See you guys later.